can have an uninterrupted transmission. Please put your audios and videos off. Okay, we should start preparing for the Facebook Live, Divya. We will be going live in exactly 1 minute.
I put it on live on Facebook.
Okay.
When you made the announcement, I put it there.
Okay, so over to you, Bhavna and Glossy.
Thank you, Rinki. Okay, a very warm welcome to everybody who's joining us tonight. Dr. Glossy, it is a pleasure to bring you back on today. Thank you for an absolutely amazing informational session yesterday. As we come to you, as we bring you Need of the Hour with CII IWN daily, Monday to Friday, 5:30 to 6 p.m. For the rest of this week as well, we will be having Dr. Glossy live with us to answer your questions. We know that access is a real issue with doctors right now. We want to make sure that at least to our CII family and our wider community, we can make doctors accessible, get your questions answered live. Okay, Dr. Glossy, thank you very much for being with us. Dr. Glossy is a leading radiologist in Delhi. She is with Jeevanmala and Apollo Hospitals. Dr. Glossy Sabharwal is also an IWN member, and we're privileged to have her with us today. Dr. Glossy, before we start with everybody's questions, and we've already started getting lots of questions, two questions that I know which are very important and keep coming up. Can I just ask you for a very short recap of those? One, what do I do if I or somebody starts feeling unwell? Can we start there, please?
A very good evening. Thank you so much, Bhavna, for having me here again. And I hope we can answer all the questions. Now, the two leading questions which we have been asking, everybody has been asking us, is that what do I do if I'm feeling unwell or anybody in my family is feeling unwell? You do 5 things. You isolate yourself, number 1. Number 2, you do not panic. Number 3, you check your temperature. Number 4, you check your pulse oximeter. Number 5, you hydrate yourself, have a glass of water, and speak to your doctor. So that's what we do.
Excellent. Thank you, Dr. Glossy, for those 5 points. And what do we do if there is no doctor available?
Yes, the second that we discussed yesterday, that if there is no doctor, and especially in the evening hours, late hours, or even during the daytime, what do you do then? You have your one set of medicine ready in the house. That, okay, I've got fever, depending on what your parameters are when you have isolated yourself. If you've got fever, what do? You take Crocin. So your 5, there should be 2 boxes made. One box has the basic set of medicines, which includes Crocin. We all know paracetamol. Everybody knows of Dolo 650, paracetamol. You keep that. Second, vitamin D, vitamin C, vitamin E, and zinc. These 5 medicines go in one box. And the other box has ivermectin, doxycycline, azithromycin. Those you are going to take when your doctor is available, when you can speak to the doctor and the doctor writes the prescription. So you can always say, Doc, I have these medicines in the house. What should I dosage? And before taking that, you must know that what you are allergic to. But the first box that has Crocin and the multivitamins, you don't have to worry, that anybody at all age groups can take. They are safe.
Okay. Great. Now, we are going to start off with our live questions because this is what we've promised everybody. And this is, I think, really the need of the hour. So after 14 days of being in quarantine, does a blood test determine that the person is negative or no longer contagious?
When you have what happens is that from day 1 of your symptom, or you're testing positive with RT-PCR if you are asymptomatic, to 10 days or 14 days of your quarantine, you are going to take all the medicines, all the precautions, everything. Now, at about 13th day or 14th day, what happens then? Then you have to check your symptoms. There is no blood test that can tell you, okay, you have COVID or you don't have COVID. Blood test in COVID is not for diagnosis. It is to see the progression of the disease. So when we say that this blood test can diagnose or tell me that I'm infective or not, no. What you need to do, you need to check your symptoms, you need to check your parameters, your fever, you need to check your pulse oximeter, and your medications are all done. Then you are absolutely safe, you can move around, but at the same time, you need to see your household. If you have high risk people in the house, then you better wear a mask for another 2 to 3 days, because dry cough might come, and it's better to have this precaution. But otherwise, there's no blood test to tell that whether you have infection or you don't have.
Okay, fine. Thank you so much. But you just mentioned mask. So mask gets worn when you're out of isolation and you're 14 days, as an add-on to Zia's question, after 14 days in quarantine. So then do you continue wearing a mask? Is that what you mean to say?
Yes, you should continue wearing a mask if your household has high risk people, which you need to see that, okay, I have got my grandmother, I've got my mother, I've got my father, they had cardiac surgery, they have kidney disease, they are high risk, they have comorbidities. Or I'm just staying with my husband, my child, and there is nobody like that, then you can maintain a little social distance, but then it's okay, you don't have to. But if you have comorbidities, then it's better to wear mask inside the house also, but maintain a distance for at least a week, so that we have covered the 21 period also.
Right. Okay. So this is after 14 days of isolation. This is between day 15 to day 21. Got it. Thank you. So now the next question is, what does airborne really mean? And the second part of this is, how is it that a family that has been locked in and they've been locked inside their house, but they seem to have COVID? And that's from Vinita.
So, Vinita, what has happened, it's a simple, okay, let's imagine, I'll give you a scenario that I am walking in my garden, okay, my house is locked, maybe outside somebody comes or not, but I am inside my house. I maybe open a window, or I have a balcony and I go there, or I'm taking a walk in my lawn. Now, what is happening is, we all know that COVID is a respiratory infection. It's a droplet infection. So when the droplet goes, suppose I cough, a droplet will become dried in the air, which will not be seen, but it's present there, and it's a droplet infection. Now, for example, somebody coughed, somebody passed by, it's still in the air, and I am wearing a mask, but my mask is not covering the whole of it. It's a single mask. It's a cloth mask, just single, because obviously, or I'm in my house, why should I wear a mask? So then what happens? You inhale that air and you can get COVID. That is what is happening. You're opening a window and outside there are people walking. You are in your house, you are not going anywhere. But because it's a droplet infection and it can be suspended in the air, you can inhale it. And that is where the research is happening, that whether it is airborne or not. But as such, there is no concrete research right now to say that it's airborne.
But what does airborne really mean? Because there's so much misunderstanding or misinformation around airborne. Airborne means like, and is there also a criteria of a certain amount of feet distance that it will travel if it's airborne? And do droplets just drop down, or do they carry across? So could you just clarify, because everybody seems to be asking, what does airborne mean?
So what happens is that we often say that you wear a mask when you are outdoors. Now, for example, I'm walking and I don't see any person next to me, because people are walking inside the park. Maybe I'm walking on the roadside, but there is nobody with me. But on that path, somebody else also walked and coughed. Maybe 5 minutes back or 10 minutes back, I don't know. Right? So the droplets will remain suspended in the air, maybe till about 100 meters also. So when we say airborne, right now we are saying for COVID, you maintain social distancing. Why? Because it's a cough and cold, say, it spreads around. So you have to maintain a certain distance. But
what is that certain distance? What is that safe distance?
The safe distance is, they say that you maintain two of your, if you let's keep it very simple, one arm length and another arm length.
Okay, so two arm lengths.
Two arm length, you stay away. But if it's airborne, then this does not carry any meaning. Because what has and why airborne came into picture was that people who are sitting in the house maintaining social distancing, sitting at least 2 feet apart from each other, were also turning positive.
Right.
So it came into this that maybe it's airborne. When it's airborne, then the distance doesn't matter because it's in the air that you are inhaling, because it's the dried droplet infection. Simple physics, how it happens. It's there, it's there. Who has walked that path before you? You don't know.
You don't know. Okay, thank you very much. And just as a follow-on to Vinita's question before I take somebody else's, she's saying these people have been in the house, no outdoor, indoor movement. Can you get it from the parcels and groceries, or if the delivery man breathes on the receiver?
Yes. So grocery, of course. What do you do then? You make your home protocols as much as you can. You put a basket outside, you let the grocery come and be there for some time. You put a Savlon spray on top of it. You do whatever possible precautions you can take, because it can come with the food on the outside of the box. Remember, it's not a foodborne infection, but
Yeah.
it can be there as a droplet on that also. The delivery boy
Be
coming.
transmitted through that.
Exactly. The delivery boy coming, Bhavna. You can have it, maybe
Yeah.
the person didn't even realize and just coughed. The
Yeah.
droplet won't, So these are the things one has to understand, that with your shoes, with the parcel, with everything, it is going to enter your house. So
Okay, wonderful. Thank you so much. Now we have, is it recommended from Sunita? Is it recommended to have the tablet ivermectin for the entire family to be on the safe side? Does it have any effect against catching the virus?
So I initially, when in 2020 the COVID thing started, everybody was keeping ivermectin in the house, and before that they were even taking that anti-malarial drug hydrocortisone. Everybody started taking, thinking that it will have some protective effect against COVID, but it did not. So that stopped. Hydrocortisone everybody was taking, then it stopped after a few months because the research said no. Now with ivermectin also, initially people started taking and said that it is a prophylactic drug. There is no medicine as of now that says that, okay, it's a prophylaxis for COVID, or it will minimize the severity. No, it's not like that. You should take it when you are exposed and symptomatic, or you have tested positive, or you are not feeling well and you know that you have to now take ivermectin. Ivermectin should never be given to all the family members. Nothing. Do not use it judiciously just like that. So it's important to have your doctor's consultation before you take ivermectin.
Okay, thank you very much for that. Sukirti has asked pretty much the same question, wearing masks at home. Seeing that if one person in a family tests positive, it seems that the whole family is getting it. So as a protective, do we wear masks at home when somebody has got COVID?
See, if somebody has COVID, that person, I'm assuming, is isolated, right? Entirely isolated, food isolation, completely, no clothes, nothing. Not that that person is in isolation and sending the clothes outside for washing. No, nothing is happening. There's a complete disconnect, totally. I mean, not a emotional disconnect, a physical disconnect.
Yes, let's make that clear to everybody.
It's only a physical disconnect to the person. So you
Yes.
physically disconnect, the person is inside the room. Then the others have to be vigilant for the dominoes effect, one after the other. So you have to be vigilant, and that will happen after an incubation period of 4 to 7 days. So if somebody has tested positive today, in the next 4 to 7 days, family member might show some symptom. So do not think second, third, fourth day will come. It will come after some time.
Wonderful, thank you. What does a HRCT score mean, and how reliable is it for disease progression?
So when we are saying HRCT, what happens? A lot of people have asked me this question, that we grade it into mild, moderate and severe. Now these days everybody knows, and the first thing the patient asks you is, what is my score? So the mild score is up to 8 to 9, moderate category is 9 to 15, 15 to 16. 16 and above we categorize into severe category. Now this is basically important for the treating doctor to know when to put you on steroids, when to give you remdesivir, when to ask for admission, and when you can be managed at home. So the progression of the disease, it is nothing that today, if for example, I am on day 6 of my disease and my score is 5 or 6, I cannot be sure that it will not become 20 or 22 or 25. There is nothing like it is. It has a very unpredictable course, and that is the reason why people are more, anxious about it. Even doctors are more anxious about it because it can suddenly take a different course. So it has nothing. You cannot predict right now that okay, this patient will need a BiPAP or this patient will go from 5 to 25. You cannot predict that. So it is only to see that at that particular time, what medicines should be given to you. That is what it is.
Okay. Thank you for that. That was Rinki. And now we've got one from Mantaj saying, does one need to get a D-dimer test after a month of COVID positive?
See, whenever you get COVID disease, there is a set of blood tests that we do, which includes D-dimers in the initial 1 week as a baseline. Now, after that 1 week, again, in the second week towards the end, depending on what symptoms you have, another test is done to see whether the anticoagulants should be given to you or not, and also if you have had any surgery in the past or not. So out of these two, the doctor will compare that the D-dimers have increased or not, whether Clexane is required or not, whatever the medicine. But after a month, it is not needed unless you have some problem. If you are having some problem, if you are having some symptoms, then, or if you are at a high risk, not otherwise.
Okay, thank you. Then Shilpa is asking, vaccination is the safest with the international vaccines coming in, and also will they work on the new variants?
Okay, so vaccine, actually I was expecting that people would ask this institute only about vaccine because I've been getting so many queries, which vaccine, but now which vaccine and why? I would say take the vaccination. Do not ask why and which, because the disease and the vaccine is as new as its research. We do not know every vaccine that we take today. For example, we take tetanus, we take so many, DPT vaccine, we give MMR vaccine, hepatitis. All of these have been researched for 10 to 15 years. And this COVID vaccine that we have done is few months old. So we are not sure that which vaccine would give which benefit. That is anybody's guess in the later stage. Right now, AstraZeneca is one option which is given in India, which is Covishield. The second is Bharat Serum, which is Covaxin. Both have not shown any major side effects as of now. Some people ask, Covishield has given blood clot and Covaxin has not. Here, it's my personal opinion that Covishield has been tested more because it's an international one versus Covaxin, which is a national one. So we have a broader research, so more side effect knowledge, smaller research, less side effect awareness right now. So both the vaccines, see, there is no rose without a thorn, no medicine without a side effect. It might have some effect, but whether that effect is more important than the benefit that it's giving, that is where you weigh it, and which the research has shown that it's better to take the vaccine, whichever you are getting.
So it's better on the whole, be protected, whatever you can get your hands on, be protected. And at the end of it, I guess it always comes back down to your and benefit, right? Your risk benefit analysis. Okay, so it's better to do it.
Yes.
Now we have another question from Vinita. So why do they say ventilate the house if it can come from outside air?
See, there is, when they say that, okay, keep the person in a ventilated room, the person who is tested positive in the family should be in a ventilated room. Honestly, ventilation or no ventilation, it has no effect on COVID if you are, for example, you have air conditioned on, but it's a window air conditioned, you don't need to open the windows. You have an AC on, you are comfortable in the room. But if you have got central air conditioned in the house, then that duct will transmit your infection. In that event, you cannot switch on the AC because it's a centrally air conditioned. So in your quarantine room, you cannot have that. You have to open the window. So that way, otherwise ventilation and COVID has nothing to do with this. And then you say that, okay, it's airborne. Again, it's anybody's guess whether it is or whether it's not. But opening a window at least will give you some fresh air. You feel nice. You have to make sure that you are not feeling sick being inside. So that is the only reason. Otherwise, if you say that there is a research of, some ventilation putting effect or making you less sick or more sick, it's not like that.
Okay, thank you very much. From Sadhna, now we've got after 14 days of having COVID, do you need to have your test done again?
After 14 days of COVID, the test, as in like the RT-PCR, I'm assuming, no, you don't have to do the RT-PCR again. What you need to understand is that you have to very carefully see your symptoms. After day 10th or day 11th, you have to start checking whether you have symptoms or not. If you don't have symptoms, if there are absolutely like you're fit and fine, there are no symptoms, no fever, no feeling, except one symptom which can persist, which is anosmia, the loss of smell. If you don't have any other symptom, then it's better that you just move out of the quarantine and seeing your household, how the low risk, high risk and all of that, you maintain the distance. But there's no need of getting a repeat test because Bhavna, it's putting so much pressure on the lab.
Yeah, absolutely.
Getting flooded with the
No, and the people who need it may just not get the access they need because you're just going back for repeat testing.
Exactly. That's
Fair enough. Fair enough. Okay, can one get the vaccine if they're taking a mild blood thinner, like low dose aspirin? That's from Malvika.
Yeah, there's absolutely, you don't have to, because see, COVID as such, the virus as well as the vaccine has nothing to do with the blood thinners, because
Okay.
there's absolutely no relation.
No correlation there.
No correlation.
Okay. From Parnika, we've got my daughter tested COVID negative on 7th March. She got her antibody test done today and her value is 158.6. When should she take the first dose of vaccine? She is 29 years old.
I'm so sorry. She tested positive when?
She tested negative on 7th March. She got her antibody test done today and her value is 158.6.
That's okay. So for anybody who is tested COVID positive, from the date of testing COVID positive, it is suggested that you wait for at least 3-4 weeks. And some studies have suggested to wait for at least 3 months. Some are saying 1 month for the vaccine to be taken. Some are saying 3 months for the vaccine to be taken if you have had COVID. So if you have had COVID, you have recovered, wait for some time for the vaccine to be taken. You should never take it, like that's what the research is saying, that don't jump into the vaccine, wait for some time. You can wait for 4 weeks or 3 months.
Okay,
Both
fine.
studies are showing wait for some time. Yeah.
So basically, I mean, at least 4 weeks minimum wait. That's the basic, right?
Yeah.
Then from Rohit, when I go for a walk, I'm wearing an N95 mask, but sometimes I can smell the guards smoking from 15 to 20 feet away. Is that a good proxy for airborne COVID-19?
Yeah, I know this happens. In fact, when I first started wearing N95 mask going for a walk, I also used to feel that I can smell everything. So what happens is that firstly, you have to understand that going for a walk wearing N95 is not the right thing to do. You'll feel breathless. If you're comfortable, it's okay. But wearing N95 should be only done when you are in close contact with somebody or more number of people. Otherwise, you can wear 2 masks. The importance of wearing the mask is the correct way of wearing it. It has to cover your nose all the way. It has to cover your mouth all the way and your chin all the way. So the wearing of the mask, and it has to be airtight here and here. It cannot be loose. If it's loose any of the parts, that is where the problem is. So still you will feel that there is some smell that you can, because our olfactory nerves are very sharp, so they can smell even from a distance.
No, fair enough. But is that a good proxy for airborne C19? Yes, no.
I don't think so. That
Okay.
it's better to put a mask, if you're putting an N95, then put another mask on top of it, like maybe a cloth mask or anything. Or otherwise, the best way is to put two masks that you can put.
Sure.
Simple two cloth masks or one cloth mask and one disposable on top of it. But what is important is whenever you are having, you're wearing a mask, the right way to wear it.
Excellent. Thank you. So if now we move to the next question, Sadhna, if test came negative of COVID, fever, throat pain, etc., but he is recovering, does he need the scan?
No, if he is
No.
recovering, if the test came negative. So first he tested positive for, right? First he tested positive for
We don't
COVID.
have any more information. It just says if the
Okay.
test
So
negative symptoms of COVID, but he is recovering, does he need the scan? Probably.
he would not need a scan. If he does not have cough, then he doesn't need the scan.
Okay. Yeah, I just want to make sure we can cover more questions, so we'll just keep it tight. Any basic difference between viral and COVID? Noel viral and COVID? Viral, she must have meant. Any basic difference between that?
There's a lot of difference.
Yeah.
We all are seeing it, right? Bhavna,
Right.
you should answer that.
Absolutely, but I'm not a doctor and I'm still going to hand it over to you. Okay, so Anchal Khanna, can fever come back to a COVID patient who is typically on his 6th, 7th day and whose CT score on the RT-PCR is 26? If yes, what's the protocol to follow when the entire house is infected with COVID?
Okay, so first part of the question, that if the CT value of RT-PCR, here we are not talking about the scan, we are talking about the RT-PCR CT value, which, by the way, the pathologists say that CT value does not carry much significance. Leaving that aside, what was the first part of the question, Bhavna? Can you just repeat that?
Yeah, can fever come back to
Yes.
a patient who is typically on his 6th, 7th day? Yes?
What has happened in this is, yes, the fever can come back, and what we have seen with the mutant strain that has come this time is that the fever is coming on early also and staying on till late, and not only that, but it is very high grade. This fever is not going down with the simple crocin paracetamol 650. We have to give other medicines, and it is persisting even till day 8th, 9th, 10th. Usually you will start feeling better on day 11th. But that is not in everybody's case. So the fever will persist. If the question is only about the fever, yes, it can persist. What do you need to do? You have to follow the same medicines.
Fine. And the second part of this, quickly we'll take this, is what's the protocol to follow when the entire house is infected with COVID?
You have to time it, that who is in which period of COVID. Who is in the first week? They go together in one room, the first week. Who is tested in the second week? They go together in the second week period. Okay, so it depends from the
So
day.
you're grouping them. Basically, you will group them.
Yes. That who is in which phase of COVID and who is higher risk for COVID. So we have to weigh that, as well as who is in which period. So if me and my husband are one period, then we go together in one room. Somebody tested later will go in the other room. We cannot have everybody around.
So should we just say rule of thumb is day 1 to day 5, you get clubbed together. Day 5 to day 10, you get clubbed together.
Day 1 to day 7, I would say.
Okay, so day 1 to day 7, you get clubbed together. Day 7 to say 14 of the first person testing, you get clubbed together. Is that right?
Yeah, that way it becomes very easy to manage the house. Otherwise it's very difficult. Yeah.
Yeah. Okay. Should we wait for the Sputnik vaccine from Sahiba?
Should we wait for the?
Sputnik. Wait for Sputnik vaccine.
Okay, so there are so many vaccines coming, Sahiba, that everybody is coming up with one thing thanks to our WhatsApp. There's so much knowledge flooding. Always trust the vaccine that is being authorized to the hospital by the government. We have no option but to trust them. I know at this time we are our trust has totally been, shaken up by the scenario, but the hospitals get the vaccines only after the research and after the medical assurance and all of that. So always see that whether your hospital is getting that vaccine or not, and not from a random center, or a private place.
Okay, thank you. We are already at 6 p.m. Can we do another 10 minutes because we've got
Yes.
5 more questions?
Yeah, let's take up the questions.
Okay, so let's make them really short here. So are loss of smell and taste short symptoms of COVID?
Yeah, they are. Anosmia
Okay.
is considered to be one of the most common. Yeah.
Okay, my husband got his first dose of vaccination on the 9th of April. This is again from Montage, but simultaneously was COVID positive. So should he get his second dose on time?
No, he should wait for at least 4 weeks or a little 4 to 6 weeks before he takes the second shot. He must wait. He should not immediately jump, depending on his disease progression, the category, whether he was in mild, moderate, or severe. Depending on that, if it is severe, then we'll wait for 2 months before the second shot. Otherwise, we will. You cannot jump into the vaccine right away. You have to wait for at least 4 weeks.
Okay, now another.
So you have to wait for about 6 weeks.
Okay, so 6 weeks. Okay. 1 second. Hold on. She's added another question, Parnika. My daughter tested COVID negative on 7th March. She got her antibody test done today and her value is 158.6. When should she take the first dose of vaccine? She is 29 years old. It's been 7 weeks since her COVID. So then should she wait for another 2-3 weeks more?
It's been 7 weeks from her COVID infection or from her first vaccine shot?
No, she's not had her first dose of vaccine. My daughter tested COVID negative on the 7th of March. She got her antibody test done today. Her value is 158.
Okay. Got it.
Yeah,
So
when should she
she
take
has to wait. She has to wait before she takes her first dose of vaccine. Anybody who has had COVID has to wait for at least 4 weeks to 3 months. That's what the research is saying as of now. But people are now, since 1st of May is coming, a lot of vaccines. So maybe a new thing comes up that there is no need to wait. But as of now, they say that if you've had COVID, you must wait for before getting your shot.
Okay, fine. From Ranjana Sharma, we've got, my son-in-law had COVID on the 8th of March. Since last night, he has 100 degrees fever and a loose stomach. Is he prone to another COVID attack, or could this just be another stomach infection?
See, having COVID after your first, so she had, the son-in-law had COVID and then COVID got okay and then he had fever again.
Yeah, my son-in-law had COVID on 8th March. Since last night, he has 100
It's
fever.
a very less probability for him to have COVID again. We have not seen cases of back-to-back COVID, that you have COVID right now and then again you're going to have COVID. So that is not happening as of now. As of now, we have not seen cases like that. But at the same time, there are cases which are coming of reinfections after 3 months. So you have to isolate him and observe him at least for 7 days and then get him tested with RT-PCR. And let's see what the results come.
Okay, thank you. So from Shweta, we've got, from when do we count the 14 days? From the day of the report or from the day someone is quarantined 2-3 days, possibly before the report came?
It's quite a task to, people have been saying, because the one who's in the quarantine is counting each day and so is the family, but the person who's locked inside the room is thinking of what it is. So what we have come as a doctor's consensus is that from the day that you had fever, because now the result is coming after 36 hours, after 48 hours. So your initial 2-3 days are anyways happening. It's from the day you have tested positive, we cannot take that anymore, keeping in mind that the results are coming after so long, after 2-3 days. The day you had your symptom, from there you start counting the 14 days from the day of your symptom. Yeah, whether it's fever or like a major symptom, not like just feeling unwell. Fever is a major symptom. Loss of smell is very mild and sometimes comes later. So fever is your symptom, or extreme weakness is your symptom.
Okay, so basically, as soon as you start feeling unwell, whether you start feeling, body aches or whatever your manifestation might be, it could be a slight cough, it could be whatever. From that day is when you start counting, right? Okay. From Rishan, we've got, what should be the antibody count to understand that one is safe from infection?
Okay, let me put it very clearly. It is not that you have antibodies, you're safe. You know, there is no, please do not keep getting your antibodies tested. It is, Bhavna, it's entirely in your mind. Okay, I have got 250 antibodies, I am safe. And that is one of the many reasons why the pandemic has happened in such a way, because people had that effect on mind that, okay, I have got antibodies. Antibodies will come and will disappear. What remains in your body is the T cells, which are the memory cells, and they remember that, okay, next time COVID happens, it's going to be mild because my body's T cells remember, the immune response remembers, and they are the fighters. So do not think your antibodies as a mark of your safety. Please don't do that. Even if you don't have antibodies, they might have come and they might have disappeared. It's nothing to do with your safety.
Okay. And why are older people at higher risk than young people? From Rohit.
See, in last year, that's what we saw, that older people were at a higher risk, or anybody with age. There are certain conditions which come on, like diabetes, blood pressure. So when you have comorbidities, obviously it's easier for the virus to act on you. You know, you are weaker, virus is smarter. So
You're more susceptible.
yeah, that happens. But at the same time, we cannot say that it's now in this 2021 strain, we are having anybody and everybody, including children. Earlier it was 2020 strain, it was elderly. So we vaccinated them first.
Yeah, true. Dr. Glossy, I think we have already gone over time. There are lots of people on the chat who have said thanks to you, really appreciated everything with you. And on that happy note, I think we'll close today's session. Would you want to add anything here, Glossy?
Yes, I would really like to add that I have been talking and telling. So it's the time that we get back to Bhavna and ask her the questions. And she needs to answer, and let's see, because if she remembers, I'm sure you know, the audience also will remember. So Bhavna, our first question to you is that what do you do when you start feeling unwell? You've asked me this question twice and I answered it. I didn't ask you that time. So, now you tell me those 5 things.
Yes. Okay. I think I know those by heart now. Things that we need to do if we are feeling unwell.
Yes.
First, we isolate. The second, we don't panic. Third, we start taking our fever. Fourth, we take the oximeter. And the fifth is we hydrate. And almost the sixth point is you call your doctor.
Yes.
Have I passed the test?
Perfect. That's have a glass of water and call your doctor. Okay, what if the doctor is not available? Then what do you do?
Oh my God. Okay, we have 2 sets of things. One are the vitamins that you keep and you can take, the zinc, the vitamin C, and not to the doctor.
Vitamin D.
And vitamin D, okay. And and then the 3 medicines that you keep for safety, only 1 set, not for hoarding. Please understand, everybody who's watching us now, not for hoarding. And again, check with your doctor, but you keep that set with you so that you can start it immediately if you need to. Those 3 are ivermectin, doxy, and azithromycin. Have I got it right?
Perfect, Bhavna. I'm so glad.
Who knew she was going to take my test? 1 second, we've got one last question and we'll close on this. Can dogs get corona? Are they a carrier?
Oh, you know, I also thought my dog, my little beagle, was sneezing the other day. He's got corona. So as far as today, there's no research that it's affecting animals.
Right.
But yes, as a droplet infection, if the dog is roaming around in the house from one room to the other, and there is that person is carrying asymptomatically and it's a droplet infection, touching your dog, yes, you can get infection, but as such, it's not happening through animals.
Okay, wonderful. Thank you so much, Dr. Glossy. We will be back, Dr. Glossy, in need of the hour tomorrow, again, 5:30 to 6. Feel free to share the link that you all have logged on from today. Everybody who has got the link, this will be live and active for the next few days. So please go ahead and share this. Till May 10th, we will be on the same link, available every day, Monday to Friday. This week is with Dr. Glossy, and next week we've got other wonderful panelists and doctors coming on. So Dr. Glossy, thank you so much. And we look forward to having you with us again tomorrow, 5:30.
Thank you so much. Entirely my pleasure. Thank you. Thank you. Stay safe.
Thank you. Thank you so much. Okay.